This is Heather Edmonds, Program Associate with the National Aging and Disability Transportation Center. Welcome to this session on multi-model approaches in accessing healthcare services. I'd like to welcome Brittany Tree, Manager of MyRide Dallas, a transportation information program at the Dallas Area Agency on Aging that helps seniors and people with disabilities in Dallas County find rides. She's been working in the transportation field for over 5 years, and she has a bachelor's degree in psychology from the University of Connecticut. We're excited to have Brittany bring her knowledge and expertise to this session. Welcome, Brittany.
Thanks, Heather, and thank you to NADTC for the invitation to talk about MyRide Dallas today. As Heather said, my name is Brittany Tree. I am the manager of MyRide Dallas. MyRide Dallas is a program within the Dallas Area Agency on Aging. The Dallas Area Agency on Aging is under the umbrella of the Community Council of Greater Dallas. Since its founding in 1940, the Community Council has identified services that are needed in the community, assessed how best services could be delivered to meet social issues, and mobilized and implemented action plans working with member agencies and public sector resources. We also house our local 211 service within our agency, and they cover 8 counties. MyRide Dallas and the Dallas Area Agency on Aging are working together on a Lyft pilot that you can see over to the side of the slide. During the presentation today, I'm going to walk through MyRide Dallas as it has been operating since roughly 2013, and then I'm going to discuss our new Lyft pilot that we have been working on about since January of this year. My contact information will be at the end of the presentation, so feel free to reach out if you have questions. Email is the best way to get in touch with me. So MyRide Dallas is a one-stop information resource for transportation options for people with disabilities and older adults in Dallas County. We offer the options counseling and transportation planning. And we can help with applications as needed for, usually locally, it's for our paratransit through our public transportation provider. We also collect data for service planning and share it as needed, and we are funded by FTA Section 5310. We have one phone number, one email address, and one website to access transportation information. What we are not. So I added this slide to presentations that I give out in the community because we are often confused with our local public transit provider, DART, or specifically a lot of folks think that we are the paratransit program at DART. Or they just think that we are a really big nonprofit agency providing rides for seniors and people with disabilities in Dallas County. But we are not. We are not a transportation provider. We are not a transportation funder. We are not a large nonprofit organization. We are a program that has 2 folks working on it. We print our Get a Ride guide roughly every year, give or take, depending on the particular year. It has a list of transportation options available in Dallas County. It covers all the information that we can get our hands on. It is available in Spanish and in English, and we print the booklet, and that is free, or you can access a PDF copy online on our website at myridedallas.org. So typically, when someone calls into our MyRide Dallas navigator's phone line, he will ask a few questions. So this I set up from the like an agency perspective. So he'll ask, where does your client live? Where are they trying to get to? What is their age? Does the client use a mobility device like a walker or a wheelchair? Specifically, of course, we need to know if they need a wheelchair accessible vehicle. So we provide them with the appropriate options. Plus a few other questions depending on the client situation. We don't require folks to give us too much information. We don't want them to feel like we're invading their privacy, but the more information they give us, the better personalized list of transportation options we can provide. So that's what happens next. They are given that list of transportation options. The client or their caregiver is still responsible for booking their trip or paying for their trip if there is a fee. And we, of course, will discuss the lowest cost options first, then move up to more expensive options if needed. There isn't always a perfect transportation option for every situation. We do have several cities here in Dallas County that don't have public transportation or specialized transportation for seniors or people with disabilities. So that really means that they only have private transportation options available to them, which is unfortunate because they can get to be very expensive. We do collect quite a bit of data during our transportation options counseling sessions. The city of residence, the age of the rider, insurance type, gender, destination city, the type of trip that they are looking for. And of all of our data that we've been collecting since about 2013, 78% of our calls are for medical trips, 12.9% are for shopping, grocery, or food pantry, 6.2% are for dialysis. We also collect information on the recommended provider that we give the rider, and then the type of provider, whether they're public, private, specialized, or medical only. Roughly 1 month after our initial call, the navigator will follow up with the rider to find out if they were able to take their trip. These responses are from our 2018 calls. 26.5% of folks said that yes, they were able to take the recommended trip. 20.8% said no, they were not able to take the trip. 4.5% were marked as no data. This merely means that they didn't want to provide contact info for a follow-up call. 45.9% we were just simply unable to reach, so we called them 1 to 2 times and they didn't answer the phone. 2.2% are not willing to participate in the evaluation. Those are folks who don't remember talking to us, or maybe they answer the phone but they don't remember who we are, so they hang up quickly or say the person is not available. That doesn't happen very often, as you can see. So we also track what provider they used and did they have any issues with their trip or comments to provide us with. The Dallas County Get a Ride Guide, we have split up into 5 chapters. We've got a section on public transportation, a section on specialized transportation, a section on medical-only transportation, private transportation, and then in our last Get a Ride Guide, we added smartphone-based transportation options, so namely Uber and Lyft. 2 notable programs that I want to mention that we have here in Dallas County that are really interesting through so we have 2 large public transportation providers. The largest one in Dallas County is Dallas Area Rapid Transit, DART. They are implementing a taxi subsidy program for residents of participating cities who are seniors over 65 or persons with a qualifying disability. This has been a really great program for folks who are falling into the gaps of maybe they can't really comfortably use public transit, fixed route services, but they may not qualify all the way for paratransit. So this is a really great way to help those folks get around our area. The fares are paid using a taxi debit card, and trip costs are based on mileage and the regulated taxi rates, but the riders are only paying for 25% of the trip cost, and DART is paying for the other 75%. Star Transit is another local public transit provider that covers a few cities in Dallas County. They have this great client advocate program. Client advocates are available to riders at no additional cost who may need assistance during trips to medical appointments only. So that's really helping folks get to those medical appointments. And the advocate can travel with the client and remain in the waiting room during the appointment. So just kind of help alleviate some of that stress of getting to the appointment on time, making sure they're in the right place, etc. So I'm going to switch gears here and talk about the Lyft pilot that we are working on with the Dallas Area Agency on Aging and MyRide Dallas staff. So our Lyft pilot is for Area Agency on Aging clients. They are receiving free transportation on Lyft using Title IIIB funds. We have the first contract between Lyft and an Area Agency on Aging in the nation. Rides are booked and monitored by MyRide Dallas staff, and the riders must be Area Agency on Aging clients. So they must be residents of Dallas County, over 60. They must be ambulatory. We use the Lyft Concierge web platform to book rides, and at the moment, we do not have access to wheelchair accessible vehicles on that Lyft Concierge platform. We do have one or two wheelchair accessible vehicles available through the Lyft cell phone app here in the city of Dallas, but we can't access those through the concierge. So the riders must be ambulatory, and they must be without any other transportation options. So these are really for, like these other programs I mentioned, folks that have no affordable transportation options available to them. The trips themselves must begin or end in Dallas County. They must be booked Monday through Friday, 8:30 to 5 p.m. We monitor the rides closely, so we need to do this during business hours, so we're keeping an eye on everyone and making sure everyone gets their rides. And the rides must be for wellness purposes. This doesn't just include medical. I'll talk about that on the next slide, but that's our key purpose for providing these rides, is for wellness. Clients register with MyRide Dallas at our traditional transportation options counseling program. So the navigator will go through their options with them, like a normal transportation options counseling session. And then if he determines that they don't have any other options, then he will refer them to the Area Agency on Aging and complete the traditional referral form. The care managers on the Area Agency on Aging side complete the client intake form or forms and assign the client a dollar amount to spend on Lyft rides. And now, MyRide Dallas, we track the rides and the funds spent while we are booking and monitoring them for them. We've provided over 2,500 rides since mid-January of 2019. We have 90 regular riders. The average cost of a ride is under $15. The type of rides we provide are definitely mostly medical. We have a handful of dialysis clients that, of course, go to their weekly dialysis treatments. We have several folks who are undergoing repeated cancer treatments and physical therapy treatments. Our next large group of ride types are grocery and food pantry. Of course, we know that food is a major part of wellness and staying healthy. And a lot of folks, seniors using fixed route services have a really hard time carrying around their groceries, and you can't have too many bags. So this is a really great way to help folks get the food that they need easily and a little more comfortably. And then we do have some folks who do agency visits like Social Security office, and then social to go visit family members. Few folks go to church in the afternoon, but of course, since we don't provide rides on Sundays, we can't do Sunday church services, but that's something we're hoping to figure out at some point in the future. So the Lyft pilot's been really great so far. It's been helping a lot of people, and it's been really interesting to work on. So we really wanted to expand MyRide Dallas and bring it into its next level of existing in the world, and this is how we are trying to do it. So here's my contact information, my phone number, and my email address, and our website, of course. So if you have any questions, please feel free to contact me. And thanks again to the NADTC for inviting us out to provide this webinar. Thank you.